I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
This week, we're going to talk about some health concerns that many people experience after the age of 40 or 50. So 50 is the new 40, and since 40 is the new 30, and 30 is the new 20, well, then if you're 50, you're 21, right? Well, not quite like that. But in all seriousness, we're glad that age is just a number, except for one thing. Nobody told your body what to expect after 50. There are some health problems that occur after age 40 and 50. Now, it's interesting because people come to me all the time and they say, Dr. Joe, behind closed doors, we're sitting in consultation, and they'll say, Dr. Joe, I need to talk about my incontinence, my loss of libido, my other issues that I'm having. And everyone assumes that they're the only ones that are having it. Well, it's not true. So this show is going to be about this is what's happening. It's not normal, by the way. It's just average. Now, I've talked about this before on other shows. Normal is what should be. Average is what's happening to everybody else. So when you hear the word, it's normal to have incontinence after 40 or 50, it's not true. It's average. So we're going to talk about what you need to do to fix a lot of these problems so you're not normal. You're not average, you're normal. That's what we got to do. So we want to prevent you from having the things that life is throwing out at you. So even if you're under 50, you need to listen up and prepare. These things are coming, I promise you. And a lot of you under 50 are having these problems already. One of the issues I hear with my patients that are over 40 and 50 is they're shrinking. One surprising thing that happens after the age of 50 is people tend to shrink, both men and women. So as we age, we lose height. And the reason is because the discs in between your vertebrae, in between your backbones, lose their water content and they lose their elasticity. So what's happening is these cushions between the bones start to wear out and the spine gets smaller. I mean, you start to shrink down. Now, they lose their shape and they become flattened out. That causes the spine to shrink and these people lose height. You can also lose height if your spine starts to curve or if you have a compression fracture. Now, what's a compression fracture? If you ever took an aluminum can and stepped on it and it crushes down, that's a compression fracture of the bone. It just kind of crushes down on itself. Now, the bone can collapse in the front, the back, in the middle. So it depends where the bone collapses. And this happens from something called osteoporosis, or an accident, of course. Osteoporosis is bone loss. So the bones become thinner. Now, this is where it's so important that you take care of your spine throughout your life. The spine will wear out if the bones are out of alignment. So if bones are out of alignment, they rub up against each other, and the disc, or the little cushion in between the bones, starts to wear out. And when that occurs, the space between the bones gets thinner and thinner. Every day, been in practice seeing patients now for 35 years, patients come into our office and say, Dr. Joe, I have arthritis. And I ask the question, do you know why? And they answer 100% of the time, no. So we're going to tell you why you get arthritis. Arthritis is real simple, one sentence. Bones are out of place, rubbing up against each other, the joints wear out. So what do we need to do? We need to get the bones back in place to take the stress off the disc so it stops wearing out. As we get older, the discs are going to become dehydrated. You're not going to have the same circulation to your discs like you used to. But there's a lot of things we can do to take care of that. So if bones are out of place, put them back in place. This is the basis of chiropractic. Most people think chiropractic is back pain, neck pain, shoulder pain. We're really good at that. However, it's way more important than that because when you get the bones realigned, it prevents them from wearing out. And if you do have arthritis, you need to stop that by putting the bones back in place. And in many cases, the techniques we use in our offices, we can stretch out the vertebrae very gently and open up that disc space. We open out that disc space, sometimes a few months after we start treatment, we can take another x-ray and we can see the disc actually starting to get thicker. It's never going to go back to where it was, but we can actually start to reverse some of the arthritis if you have it. And the danger of that is the bones pinch the nerves. Nerves control organs. So the messages from the brain can't get to the organs. The organs aren't able to work properly if you have a pinched nerve or compressed nerve because of the disc wearing out. So your discs are going to lose circulation as we get older. That's why you want to do the right nutrients, things like Dr. Joe's nitric oxide to increase circulation. Stretching is important, things like yoga, and chiropractic care. I cannot understand for the life of me why chiropractic care is not the entrance point for almost all healthcare conditions. And it will be, I promise you. This is a Dr. Joe prediction, and Dr. Joe's never been wrong in his predictions. Third person talking about there. We have a paper, a file we have at the office called Dr. Joe is Right. And in Dr. Joe is Right column, we talk about things we've talked about in the past that now have just become mainstream. And I promise you, chiropractic care and holistic health is going to become the entry point for almost all healthcare problems. I'm going to give it 10 years. It's going to happen. And so you might as well be ahead of the curve and not have these degenerated conditions that may not be reversible. So shrinking is one of the things that happens when you get older, but you can really slow that down or essentially stop it if you take care of the spine. Another issue that happens when you get older, you're incontinent. Men and women alike experience incontinence as they age. What that means is you leak a little pee. This includes leaks, urgency, as well as more frequent urinations, prompting a lot of people to restrict the amount of fluid they take, which can then put a stress on the kidneys. You need to drink a lot of fluid. And here's the ironic part. The more fluid you drink, the stronger your muscles get and the less incontinent you're going to be. Now, there's a couple other things that can cause incontinence. Number one, pinched nerve in the low back. The nerves in the low back might give you back, hip, leg, knee, and foot pain, but they also control the colon, sex organs, and bladder. Countless patients I've seen over the years that have had incontinence or leaking of urine, when they get chiropractic care, that problem is solved. And I've had many, especially women, it's worse for women than men traditionally. They'll come to me and say, I don't know what to do. I'm wearing diapers, I'm wearing absorbent underwear. It's getting worse. I'm afraid to go out. I'm afraid I'm not going to be able to control myself. And once we start opening up the nerve supply and getting the organs working properly, it's amazing. An exercise you can do is something called Kegels. Kegel exercise is you pee a little bit and then you stop and you compress, hold the urine. Then pee a little bit, hold the urine. Pee a little bit, hold the urine. Do 10 Kegels every time you pee. Every time you pee a little bit, stop, pee a little bit, stop. And that's going to build up those muscles. Now, if you wake up at night peeing a lot, there's a real simple solution to this. And the solution is not drink less water. It's when you drink the water. Drink the water earlier in the day. So when I wake up in the morning, big cup of tea usually. If it's the summertime, I'll have a big cup of water or maybe some lemonade, organic lemon juice, some stevia. And I'll drink a lot of fluid up till about 3 or 4 o'clock in the afternoon. And then I slow down. And then you don't have to pee as much at night. But the Kegels, the chiropractic care, and changing when you drink your fluid. Don't drink less. Just drink it at a different time. Most cases going to solve that problem. Now, another issue that happens for older folks, they've lost their libido. Now, this is an obvious one, although it's not just the urge, but also the desire. Many people over 50 have lost their interest in their romantic partners, and many times they just don't feel sexy themselves. Therefore, they're not interested in romance. So there's a couple of things we need to do about this. It's okay for your romantic drive to get less and less as you get older. That's normal and average. However, there are things we can do to prevent that, because one of the things that happens, especially for men, if a man has erectile dysfunction, that can be a sign of a heart condition. Because we need circulation to get our organs working for men and women. And if we're not getting good circulation, it could be an indication that there's something wrong. So several things you want to check. Number one, again, the nerves in the low back control the sex organs. So if you have a pinched nerve, that can affect the function of the sex organs. Hormones can be off. Years ago, we weren't exposed to things like steroids, chemicals, hormones, antibiotics, pesticides, herbicides, genetically modified food, and now it's everywhere. Okay, even weed killer. The one famous weed killer, you see it on TV, they're suing the company for all these people that are dying from cancer from exposure to this weed killer. That weed killer is an endocrine disruptor. What an endocrine disruptor is, it's something that acts like a hormone, and the hormone that it acts like is estrogen. Estrogen counteracts testosterone. So therein lies the problem. Testosterone is your sex drive hormone. And so you've got to be careful with that. And I've done a lot of shows on this. If you go to the website, drjoe.com, we've done shows on male hormone, female hormone. So you want to listen to those shows if this is a concern of yours. And by the way, it should be a concern of yours. Because loss of libido is a sign that we're getting older, but we can fight that. Because it's more than just loss of libido. It's loss of muscle function, it's loss of circulation, and the hormones can be off. Now, in our office, we can do hormone panel testing. We can do a test for men and women. And we have the male hormone support. It's a supplement. It's on the website, drjoe.com. We have the female hormone support, and we have the estrogen support. And all of that's on the website, drjoe.com. Another thing you can do is take nitric oxide. Nitric oxide is a vasodilator. It opens up your blood vessels. And so by opening up your blood vessels, it increases circulation. The way to slow down your reduction, that's the right word, of nitric oxide is to avoid things like high fructose corn syrup. Fructose is a sugar. And if you had white table sugar, for example, half of that is fructose, half of that is glucose. The glucose gets utilized as fuel by the body, and you get to use it as energy. The fructose has to be converted into glucose. And so what do we do about that? It has to happen in the liver, and in the process, we create something called uric acid. Uric acid gets in your joints, and it hurts. Now, as a chiropractor, my team of doctors and I work on pain every single day. We are really good at dealing with pain patients and getting patients the result they want. You got to stick with us, though. It's not going to happen in one visit. Just so you know, we're not that good. Nobody's that good. So once we get the diet working, we get the nervous system working, we get the digestive system working, a lot of pain is reduced because we're getting to the cause of the pain, not just treating the symptoms. But if you're eating fructose, it converts into uric acid. Uric acid gets in your joints and it hurts. You're fighting us. That's why every patient that comes to see us, we do a nutritional workup on. Uric acid prevents the body from producing nitric oxide. We need nitric oxide to increase circulation. And so we're seeing problems that 20, 30 years ago only happened in old people are now happening in young people. I have patients coming to my office in their 20s having function disorders for men and women, and a lot of it has to do with circulation. Because we didn't have high fructose corn syrup decades ago, now we do. Where do you find high fructose corn syrup? Everywhere. And so if you're doing high fructose corn syrup, what's happening is it's getting into the body, it's creating uric acid, which gets into joints and it hurts. Uric acid prevents nitric oxide production, which is going to affect circulation, and now you're going to have issues. Now, it's not just the reproductive organs that are affected. Your brain is affected by circulation. Every cell in the body is affected by improper circulation. So high fructose corn syrup, for many reasons, is not something you want to stick with. You want to get that out of your diet as quickly as you can. So if you can do that, that's great. And then, of course, we can do the hormone testing at our office to see where the imbalance is, and then we can recommend specific recommendations. But as a general rule, Dr. Joe's hormone support for men, Dr. Joe's hormone support for women, and then the estrogen balancer, that's for women as well. And that's for women that are premenopausal. And so all that's on the website, drjoe.com, those supplements. Another thing, talking about things that happen to you as you get older. Another thing that happens is your lower eyelids start to get a little wonky. They start to get more fat, and it builds up in the lower eyelids, and that can show up as lower lid malposition. It starts to get bulky. Now, your eyelid might be abnormally high or abnormally low. It might start to droop. It can turn inward. Here's the things with eyelids. They really are a diagnostic tool. Just a bag under your eye, a little dark circle, that's usually an adrenal problem. When I see bags under the eyes, it's almost always an adrenal issue. However, if you start to see what looks like crusty fat around the eyes, that can be a sign of high cholesterol. So we can test the cholesterol through a blood workup, of course, but if you start to see that under the eyelids, you might want to get that checked right away. It looks like little scabs, only it's yellowish. Those are signs that you could have high cholesterol issues, and then we got to find out why you're having high cholesterol. I understand. We can do a blood test and say, yes, you got high cholesterol. Here's some statin drugs. We're going to lower the production of cholesterol in your body, and that's going to be awesome. But it doesn't treat the cause. It treats the symptoms. Why do we have high cholesterol? Could be back to high fructose corn syrup, clogging up your liver. Your liver's not working properly. And so we got to look at that. We got to look at the bags under the eyes. Is it an adrenal issue? We can do adrenal testing in our office. We can test your adrenal function and find out if your adrenals are weak. And if they are, we got to get you on a certain protocol specifically for adrenal support. So it's really important that these symptoms that we're talking about today, and we got a lot of them, we're not going to cover nearly all of them that I'd like to today, are signs that there's something wrong. And if there's something wrong, you want to fix it. Make sense? Yeah. That's the whole thing about what we do in our offices. We get to the cause of the problem, not just treat the symptoms. Other things that happen as you get older. You're more susceptible to stress. Now, who wouldn't be? All we've lived through as you get older and the potential pitfalls that go along with everything you've been through. Think about it. As you start to get older, what's happened? Family have probably died. You've been through some bad relationships. You've had issues at work. You've had issues with maybe your health. And so the older we get, the more stress starts to pile up. Now, stress is inevitable. We're all going to have it. What's essential is that you don't let the stress consume you. Stress over time can create apathy and a lack of joy. You know what? I really don't care. How many people just want to stay home as you get older? Remember when we were in our 20s, we'd go out every night partying and drinking and eating pizza until 4 in the morning. Now it's like, oh my gosh, it's Friday. I can't wait to go home and do nothing. Yes, that's okay. That's normal. You've gone through your cycles in your life, and there's chapters in your life, and just go through one chapter to another. That's perfectly fine. But when you start to become a hermit, when you don't want to go out, when you stop liking people, that becomes a real serious issue. So as people age, they become overburdened and saddened by their current life experiences. You start to think, what have I done with my life? I've been a failure, or I haven't reached all the goals that I want, even if you're not at that level. So the advent of midlife crisis to create joy and excitement in one's life is real. You start to get into your phase right around the 40s, and you start to think, I just don't have as much fun as I used to. I'm not going out partying. I'm not as romantically inclined as I used to be. I don't have the energy I used to have. And so now you may do something crazy just to try to, ignite that fire one more time. Midlife crisis. Doesn't work because you're not getting to the cause of the problem. You're trying to treat the symptoms. So there's 3 types of stress I need to discuss with you: chemical, physical, and emotional. Now, physical stress, as a chiropractor, we deal with that all day, every day. Neck pain, back pain, shoulder pain, elbow pain, the wrist is hurting, you're not as flexible as you used to be, muscle spasms. So from a chiropractic standpoint, physical stress is what we're really good at. We rock it when it comes to physical stress. So with physical stress, you might want to come see us so we can get a handle on that for you and try to correct it. Emotional stress, let's talk about chemical stress first. Chemical stress is what you have control over in most cases. It's what you eat, the environment you expose yourself to. So if you're eating what I call the 7 deadly sins, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, that's all under sugar. You have control over that. Now, I've been coaching nutrition for 30 plus years. I've never had a patient ever, in all the years I've been doing this, ever come to me and say, Dr. Joe, I took all your advice and boy, it was the stupidest thing I ever did. No, 100% of the patients come to me and say, Dr. Joe, I'm so glad that I did this. Now, some people do everything. Some people do a few things. Either way is fine. You can take small steps. You can do it all at once, as long as you're getting there. And they say, Dr. Joe, why didn't I do this sooner? I had no idea that my headaches were caused by blank, artificial sweetener, monosodium glutamate, dehydration, alcohol, digestive issues. Acid reflux can cause things like headaches and other problems. So when we get to the cause of the problem, they get really excited about it. So the chemical stress you have control over. This is not the show to go into the chemical stress, but if you want to learn more, go to my website, drjoe.com, and we have a lecture that we did called The 7 Deadly Sins of Nutrition. Just type in the search bar, 7 Deadly Sins of Nutrition. We have a whole hour on what not to eat. Then we have a follow-up, a companion to that. So after you do that, type in the search bar, so what can I eat? And we have a whole hour lecture on what you can eat. One's an audio, one's a video. And you can learn what to eat, what not to eat. It's real simple. And here's the catch. It's cheaper than anything you're doing right now. You'll probably feel better. Studies have shown if you just gave up dairy products, just dairy, nothing else, you'll probably add 8 quality years to your life. If you went to a plant-based diet, you're looking between 11 and 18 quality years. Holy cow. If I had a pill and I said, here, take this pill, it can give you between 11 and 18 years of quality life, would you take it? Absolutely. There is no pill, but you have control over it. And so it's really simple. Now you can do some of it, you can do all of it, take steps, get to where you need to be. So that's the chemical stress. And then emotional stress, we probably don't have a handle on for you. Sort of we do. I'll talk about digestion in a second. But if a family member dies, if you have a bad relationship, if the stock market crashes, you lose your money, you get robbed, you get beat up or something like that, and there's an emotional trauma that goes with it, it's easier to handle if we fix the physical and the chemical. And with the emotional stress, your brain runs on something called neurotransmitters. And if your stomach is not digesting food properly, this is how it's going to affect neurotransmitters. If you have acid reflux, heartburn, burping, gas, bloating, your stomach could be pushed up against your diaphragm. If the stomach is up against the diaphragm, you're not breaking proteins into amino acids. Now, the amino acid tryptophan specifically becomes serotonin in your brain. Serotonin is the neurotransmitter that makes you happy. Tyrosine becomes dopamine, which gives you pleasure. Glutamine becomes GABA, which helps suppress pain. And norepinephrine, which gives you energy. So if you're just depressed and horribly miserable and you just can't seem to come out of it, think about it. Do you have a digestive issue? Almost every patient I've ever seen, I can probably say every patient, but I can never say always. Almost every patient I've ever seen that has an emotional issue, we have to fix their digestive system. And that allows the stomach to break proteins into amino acids to become neurotransmitters so the brain can actually work again. So emotional issues sometimes are related to physical and chemical issues. So if we fix the spine and we get the joints working, we get the digestive system working, get you on some good food, chances are you're going to do well. Most of us don't even get the minimum nutrients we need every day. So the minimum nutrients you need every day, there's a product called Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders, scoop of each, mix it together. They taste great. I mix it with coconut milk or almond milk. You can throw a frozen banana in there if you want to change the flavor a little bit, some frozen berries, whip it up. The minimum supplements you need every single day are Dr. Joe's Super Greens and Dr. Joe's Essential Source. Those are on the website, drjoe.com. I can't imagine why you're not doing that. So if you're not doing it, go to the website. I recommend you do it. Okay? Other things that happen as we get older. Your shocks and your struts start to wear out. One health problem is joint pain due to degenerative joint or disc disease. That's what we talked about shrinking. That's the degeneration of the discs. It's also known as osteoarthritis. Rheumatoid arthritis is an autoimmune disease. Your body's attacking itself. Osteoarthritis is mechanical. So if the bones are out of alignment, whether it's the shoulder, the hip, the wrist, the toenails, not the toenails, the toes, the bones are going to rub up against each other and they're going to start to wear out. And even if bones are out of place, we joke about that, the toenails can rub up against each other and cause problems. So if bones are out of alignment, what's the most logical thing to do? Put them back in place. It's not hard to figure this one out, folks. Osteoarthritis always has a mechanical component. So you got to get it fixed. Rheumatoid is an autoimmune disease. That's a more chemical component. But again, I ask my patients every day, do you know why you have arthritis? And the answer 100% of the time is no. And I tell them in a simple sentence, bones out of place. Many of my patients who have been in their early 50s feel like they're too young to experience arthritic pain. I'm too young to have this problem. How many people say that? Raise your hands. A lot of you. So I like to describe the weight-bearing joints such as hip, the knees, the ankles, even the lower back as the shocks and the struts, the things that absorb shock. And over time, they start to wear out. This is known as degeneration or disc disease. Also DJD, degenerative disc disease, degenerative joint disease, osteoarthritis, spondylosis, has a lot of different names. It's all pretty much the same thing. Now, as the joints wear out, they can cause pain. So exercise requiring repeated use of these joints or even obesity can cause the cartilage, that's the cushioning in between the joints, to break down even faster. So once again, if something's out of place, what would be the most logical thing to do? Put it back in place. I don't know how to make that any easier for you, folks. I can't make it any simpler. If a bone is out of place pinching a nerve, put it back in place. If the bones are out of place pinching nerves that don't feel pain, because 90% of your nerves don't feel pain, put it back in place. It's pretty simple. So if we can get those bones back in place, takes the stress off the joint, unpinches the nerves, prevents arthritis from happening, and unpinches the nerves that don't feel pain because they control the organs. I can't make this any simpler. I have spent 35 years trying to get as simple as I can to you guys. Get the bones put back in place. And that's going to prevent a lot of problems that happen as we get older. Biggest regret I have in my life is that I didn't get chiropractic care as a child. Had I received chiropractic care as an infant or as a child, my life would have been totally different. Because by the time I finally got my first adjustment at 18 years old, I already had some arthritis in my spine. I already had 2 fractures in my spine. My spine was a mess. So without chiropractic care, I'll tell you this, we wouldn't be having this show right now. I promise you that. It really helps keep you young and keep the body functioning normally. The most important thing your spine can have is flexibility and mobility. And the number one thing to do that is chiropractic care. So if you want to make an appointment, you always go to our website, drjoe.com, and you can make an appointment to come see us. Other things that happen as you get older. You can have sleep-disordered breathing. That's a big issue. How many people snore? Raise your hands. I'm going to have to go to break. When I come back, we're going to talk about snoring, sleep disorders, sleep apnea, and what to do about them. Because that's a big issue that happens when we get older. And the nice part is, in most cases, it's pretty easy to fix. So, folks, if you're sick and tired of being sick and tired, if you're ready to get well, I want you to go to my website right now, drjoe.com, drjoe.com. Can't make it easier for you. drjoe.com, the supplements we talked about, Super Greens, the Essential Source, the nitric oxide. We're going to talk about some other supplements coming up too, digestive enzymes we're going to talk about. Order them on the website. If you want to make an appointment to come see us, and you need to, you want to get your spine checked to prevent a lot of these problems. So if you have pain, you have a problem. If you don't have pain, let's check it to make sure there's no problems that are going to come up in the future. Website is drjoe.com. We have offices in Marietta, Duluth, and Stockbridge in the Atlanta area. We want to be your doctors. And if you've ever been in a car accident, if the car was damaged, you were damaged. You need to come see us right away. Stop suffering needlessly. Go to the website right now, drjoe.com. Make an appointment to come see us. I'm Dr. Joe Esposito. Tell your friends about the show. We'll catch you next time. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.